Hi, welcome to Module 2 on Person-Centered Approach for FGM Prevention and Care. We're going to talk about the characteristics and principles of person-centered communication. This session will focus on communication and the verbal and nonverbal skills that are needed to communicate effectively with women who are attending a routine health checkup. Secondly, this session will focus on specifically person-centered communication skills for discussing FGM and delivering FGM prevention messages, as well as enabling and empowering women to change their beliefs and values about FGM. By the end of this session, it is expected that you as the participant will have discussed the importance of effective communication during a clinical consultation, and you'll have become motivated to apply person-centered communication, which we shall refer to as PCC, in the context of a clinical consultation. So, what is effective communication? This is a two-way process where people share information or discuss an issue together to try and reach a mutual understanding. It is two-way because the sender transmits the message, the receiver generally provides feedback that the message has been understood. And the feedback in this case can be verbal. For example, you could say the words aha, or non-verbal, for example, using a gentle head nod or eye contact. Effective communication takes place when a message is delivered, it's received, and it's understood in the way that it was intended. And in the context of a clinical consultation, both the healthcare provider and the patient can be the sender and the receiver of information. That is, that their roles alternate throughout the clinical consultation. And what is the difference between person-centered and provider-centered communication? In provider-centered communication, typically, the healthcare provider asks all the questions and guides the whole clinical consultation. The focus of the healthcare provider is only on the patient's medical complaint or the disease, and sometimes they can forget to ask about the woman's perspective. In this type of communication, all the decisions made during the consultation are made by the healthcare provider without the input of the patient. Healthcare provider usually fail to consider the woman's preferences, needs, and values. Conversely, healthcare providers who communicate in a person-centered way typically allow the woman or the patient to tell her concerns. They listen to her attentively and pay genuine attention to her ideas or any problems that she may raise. They give her the information she needs so that she can make an informed decision, and they check whether she has understood what she's being told and encourage her to ask questions. So, why should healthcare providers learn about person-centered communication? As we've seen, communication is very important in everything we do in life. We communicate with family members, we communicate with our friends and peers, with our colleagues, and with our supervisors. It is a process that influences the quality of our relationships. And many of our problems in our personal and professional relationships usually result from poor or inappropriate communication. For these reasons, therefore, learning person-centered communication skills will help you as a healthcare provider to become a more effective communicator, to become a better healthcare professional, and to become a more trusted colleague. A person-centered communication approach has several benefits for both the patient and for the healthcare provider. For the patient, it increases satisfaction with the care that they are receiving. It provides a better relationship with their healthcare provider. It reduces their anxiety and makes them feel more secure during a clinical consultation. It provides greater comfort and ability to discuss their needs. It increases the trust that they have for their healthcare provider's competence. It improves understanding of medical instructions and makes it easier for these patients to follow indications and continue the treatment. And finally, it increases effectiveness of medical treatment. For the healthcare provider, a PCC approach improves the quality of care that they provide to their patients. It improves the relationship with their patients. It allows them to better understand the needs of their patient. And providers who communicate effectively also feel more self-confident and they have improved job satisfaction. Just to emphasize, A person-centered communication approach means communicating with your patients in ways that allow you as a healthcare provider to understand the patient's perspective so as to motivate them for change. You understand who they are as a person, what their personal beliefs and values are, and what their expectations, needs, and feelings are about their health and well-being. The care and support to patients using this approach should be guided by their needs and unique circumstances. When we as healthcare providers communicate in a person-centered way, our patients feel that their care is planned with them rather than simply for them. Additionally, the chance that our patients will follow the treatment plan or the planned behavior change is much greater. It's important to remember that in the context of FGM, the role of the healthcare provider, while respecting the patient's perspective, is always to work towards stopping FGM. So, what are the skills for using effective person-centered communication? Number one, you create a welcoming environment for the patient. By creating a welcoming environment, the woman will feel safer and less anxious, and this will allow her to express her needs and concerns with less difficulty. It will also improve the provider and patient relationship. If a woman does not feel welcome or at ease, it will be almost impossible to communicate effectively with her. Some tips on creating a welcoming environment. Always greet and welcome the patient in a friendly yet professional manner. Make some positive remarks about non-medical issues, for example, the weather, generalities about the day. For example, you could ask her, how was your journey here? Was it okay? Use the patient's name. You can look it up in her medical record as she's coming in. Introduce yourself, give your name and your role, and ensure that the patient's privacy is maintained. If possible, close the door or draw the curtain. The second skill for effective person-centered communication is speaking clearly and simply. This means using terms and speaking in a way that the patient understands. Some tips for speaking clearly and simply include avoid using complex medical terms, speak slowly, giving time for the patient to ask any questions, regularly check whether the patient has understood the indications given, and before bringing the consultation to an end, making sure that you ask the woman if she has understood and if she has any extra questions. The third skill needed for effective person-centered communication involves actively listening, which is basically hearing what is being said. This entails hearing what the patient is saying by paying close attention to her words and her body language. Some tips for active listening involve listening and paying close attention to what is being said, listening without being distracted, so not looking at your phone or the computer, paying attention to verbal and non-verbal messages or cues. People typically often express their feelings through their actions and facial expressions, and concentrating, listening, asking questions, and taking time to really hear and clarify what people are telling you during a clinical consultation. Active listening also involves not rushing the patient and not being afraid of periods of silence during the clinical consultation. It involves not interrupting, correcting, or speaking over the patient when she's speaking. It also involves using nonverbal encouragement such as head nodding, having appropriate eye contact, and avoiding crossed arms or legs. It also involves using continuous to encourage the woman to speak, and these are words and sounds such as go on, ha, etc. The fourth skill for effective person-centered communication involves using effective interviewing skills. These include clarification, summarizing, and encouragement. Clarification is respectfully asking questions during the interview so as to clarify words or ideas as well as emotions that the patient might have expressed. Clarifying words and ideas could involve asking questions like, could you please repeat what you just said? While clarifying emotions could involve asking the patient, how does this make you feel? On the other hand, summarizing can be achieved in the following ways. You could restate the main points of what the patient has said, and do not just repeat but put into your own words how you've understood the patient's situation. Also, do not state as fact. Use words that show that you're checking whether you've understood correctly. You can summarize by using the following phrases. what I'm understanding is, or you could say, so what you're saying sounds as if, or you could say, I'm not sure that I'm understanding you correctly, but it sounds like. Finally, encouragement involves helping to give recognition to a patient's feelings and actions and highlighting these in a positive way. You could say, you've had a difficult time and you've handled it well. Or, that's great that you have decided to talk to your family about this specific issue. The fifth skill for effective person-centered communication involves asking open-ended questions. It's important to note that during a clinical consultation, both the healthcare provider and the patient ask questions. For the healthcare provider, it is easier to communicate effectively with the patient when using open rather than closed-ended questions. Closed questions typically shut down conversations because they are answered with a yes or no. They can be used when precise information is needed. For example, did you come here by bus? Have you been cut in the genital area? On the other hand, open-ended questions open up communication. For example, how are you feeling today? How did you travel here? Tell me about yourself. When asking open-ended questions, the healthcare provider can use prompting words such as then, and, because these encourage the patients to keep talking. Open and closed-ended questions can work well together. Open questions are very useful when, for example, starting a consultation. For example, hello Ms. Okoye, how can I help you today? They can also be useful when you want to gain a broader perspective on a patient's situation and context. For example, I would like to try and find out why you feel you should cut your daughter. Could you provide me with some reasons? And how does this make you feel? The sixth skill for effective person-centered communication involves expressing empathy. This is defined as the ability to understand and share the feelings of another person. Empathy is important because it enables us to recognize the feelings of another person and communicate that we understand, thereby building rapport. It also allows us to understand the individual's perspective towards providing person-centered care. Empathy also shows respect and gives emotional support to the patient by letting her know that you really understand her feelings. Empathy is contrasted to sympathy, which is described as feeling of pity and sorrow for someone else's misfortune, while empathy involves trying to understand the other person's perspective. The final skill for effective person-centered communication involves being non-judgmental and promoting dignity and respect. As a healthcare provider, you should try to remain non-judgmental at all times, even if the woman's views are different from your own. An example of judgmental answer includes, I cannot believe you did something like that. What were you possibly thinking? That is definitely not okay. I'm sure a lot of people will agree with me that that is not something that you can say. As a healthcare provider, you should always treat patients with dignity and respect, which is your ethical duty. An important tip for being non-judgmental and promoting dignity and respect involves not passing judgment. If you find yourself being judgmental towards your patient, stop and instead try to understand. When asking sensitive questions, always ask for the patient's permission and make sure that she's comfortable discussing the topic. For example, you could ask, I would like to ask you a question about FGM. Will that be okay with you? Or, I wonder if we could spend a few minutes talking about FGM. Note that each of these questions is formulated in a polite manner, and it gives the woman the chance to say if she's willing to talk or is uncomfortable. In conclusion, here are some key takeaway messages. First, effective communication happens when people discuss an issue together so as to reach a mutual understanding. The skills that are needed for effective communication can be learned. Effective communication has several benefits both for the patient and for you as a healthcare provider. Learning effective communication skills helps you as a healthcare provider to become more successful as a communicator, to become a better healthcare professional, and to become a more trusted colleague. Specifically, person-centered communication means communicating with patients in ways that allows you as the healthcare provider to understand their perspective. Person-centered communication helps patients to feel safer and less anxious, which allows them to better follow your medical instructions. The 7 key skills for effective person-centered communication during a clinical consultation include 1. Creating a welcoming and safe environment. 2, speaking clearly and simply. 3, active listening, which is truly hearing what the patient is saying by paying close attention to her words and body language and making sure that she feels that you're registering what she's saying. 4, using effective interviewing skills, which include clarifying, summarizing, and giving encouragement. 5, asking open-ended questions. 6, expressing empathy. And 7, being non-judgmental and promoting dignity and respect. Thank you very much for listening to me. Here are some additional references that could be helpful as you become a more effective person-centered communicator. Thank you.